I'm Dr. Craig Escude, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More here.
Welcome to this episode of IDD Health Matters. Our guest today is John Raphael with the National Alliance for Direct Support Professionals. Welcome, John.
Thank you, Craig. Appreciate being here and talking to you about important things.
Absolutely. So we're coming to you today from the NADSP, the National Alliance for Direct Support Professionals annual conference in Pittsburgh. And you've had a lot of things going on at the conference, right?
Oh,
keeping busy?
I'd say it's been 2 days, but it feels like 2 weeks.
Yeah, understood.
2 good weeks, but it's a lot that goes into this conference.
It's a great conference. So John, what's your role in NADSP?
What I do, Craig, I'm the Director of Educational Services, and what that means, I'm responsible for all the content of what we spread throughout the United States, throughout North America, really, when it comes to anything dealing with direct support professional development, not training per se.
It's a really small role. It doesn't take much time to do, right?
Well, you'd be surprised how unbelievably complex.
Oh, I was kidding.
No, I know. But here's the thing: when we talk about development or education for direct support professionals, that's something that, in fact, direct support professionals, that's not what they're offered. They're offered training.
Understood.
And I could talk all day about the differences between training and actual education and development. And that's really what we focus on, is the education and development of direct support professionals, direct care workers throughout the North America.
So when you say development, what does that mean? What are you developing? What are you wanting to see develop in direct support professionals?
Yep. It's an important question, and I can answer it pretty squarely here. Most direct support professionals, and let me just quantify and qualify what that means, a direct support professional, that's a person, and I'm talking about just in the field of supporting people with intellectual and developmental disabilities. There's about 1.5 million that we can count to the best of our ability. Yep. That's just in the United States in the intellectual developmental disability sector, right? So the way they get their jobs and how they get their work to become direct support professionals is generally considered entry level. No different than going to work for a fast food restaurant or going to work for a retail operation or any kind of entry-level job where you get hired, you get trained, and you go do the work. That's how direct support is treated. It is not.
You and I both know it's way more than that. Way more than that.
And that's what our mission is, to change that, right? And so most direct support, when you say to answer your question about development, what that means, most direct support professionals, and this goes to this notion of training versus development, there's mandated training for direct support professionals, often required by states in which the direct support professional
You're typically
operates.
Probably health and, mainly safety related type training, because they don't get a lot of health training either.
No.
So safety, regulations, rules, that type stuff.
And here's it. Direct support professionals get trained what to do on the worst of days. What to do if something's on fire, what to do if somebody is, their heart stops and they need to do CPR, what to do when somebody's choking. Those are very bad days.
And I'm not saying few and far between.
Yeah, hopefully.
And they do happen and they're important, but
most of the time, this even as a physician, people are breathing, hearts haven't stopped, and things aren't on fire. So what do you do in those moments when that stuff's not happening? DSPs often, I think they struggle.
Well, because, I would struggle if I was asked to do something that I had no experience in and was not provided any education or training on.
Yep.
And
there it is. We're teaching a profession by virtue of quote unquote training, but the reality is that's really not no direct support. And I can say this, and I'm happy to say this, and I have somewhat of some license to say this. direct support professionals are not ready to do direct support work initially coming from any kind of orientation process. They're not ready. There's way much more that goes into becoming a direct support professional, and that's where we get into development. What does that mean, right?
You saying that is I mean, it makes perfect sense. I mean, I graduated medical school. I wasn't ready to provide healthcare. That's why there's residency, which is that development part of it and that additional training. And yeah, I mean, direct support professionals are doing much more than working in a fast food place and flipping burgers and things like that. So they are actually responsible for almost every aspect of a person's life.
Yeah. Literally.
Yeah.
And that's not exaggerating, because when you really look at, and I'm just going back to the residency piece for a physician, our parallel to that and what we're striving to do, and I think we're getting some headway, is a certification process, a credentialing process for direct support professionals. And that, even to this day, doesn't exist on a standardized basis anywhere, even at a state level, certainly not at a national level. We have a national certification process that's based on competencies that come from the Centers for Medicare and Medicaid Services. But the reality is most direct support professionals they don't have access to that, or it's not available to them. So in terms of like a residency, really truly learning how to do direct support, how to support people with intellectual developmental disabilities, happens when you're with the people with intellectual developmental disabilities in whatever setting. Yeah. And there's a great reliance on very good supervisors. You could have the best trainers in the world, but the ongoing reinforcement for that direct support professional comes day to day, hip to hip, with really good supervisors and really good peers. That's essentially how DSPs have. I think that's how they get developed very well. We want to enhance that. That's basic, and that's my role. That's what I do with the materials that we create. And it's not like I sit around, drinking beer, creating things. We use validated, research-based competencies. We have a code of ethics. We work with people like you that have really research-based resources for direct support professionals to use, whether it's medical things or person-centered planning things, whatever the things are. The DSPs need much more availability and access to these things.
So, John, how did you get your start in this field? How did you end up where you are?
Oh, goodness, accidentally, like many of us. I was 20 years old. I needed a job. I grew up in New York, not New York City. I grew up in upstate New York, near Poughkeepsie, New York. And 20 years old, I was going to be a rock star, man. I played bass. I was going to be in bands.
That may not be over yet. It could still happen.
It could. Hey, look, everybody's dispensable. Bottom line is this: I needed a summer job because I was going to be moving to California and whatever. Needed a summer job, and very long story short, looked in the paper for a summer job. Saw this job, which I thought was a camp counselor gig. So I said, "This is perfect. $6 an hour." This was back in 1986, and it wasn't a camp counselor gig. It was. I went to the interview, and it was they were looking for child care workers, direct support professionals to work with people to work with adolescents in a residential treatment center, 120 boys and girls. They hired me within 10 minutes to be a direct support professional. Didn't know what the heck I was doing. I got 3 days of orientation and training, went into the dormitory, and to answer your question, that summer job for me lasted 8 years. I fell in love with the work. I fell in love with the people and the kids I was working with, and I have never left, really. The reason I'm now doing what I do is as a direct support professional for 8 years. Here's the darker side of things. I couldn't make a living. I needed to go into management. I needed to go out of direct support to actually make a living in human services. I chose to become a social worker, and in the years that since 1986, I've always been in direct support circles and doing things to develop and engage and teach and train and do direct support currently. At this conference, I've been doing direct support with a few people. So I hope that answers your question. I got into it by accident. I had and most people do, because in fact, direct support it's not an identified career path. people accidentally get into it.
Really, in any career path related to supports and services for people with intellectual and developmental disabilities, either you know someone or have a family member or some personal experience that brings you into the field, which is probably less common than you just kind of fall into the field. I mean, as a physician, I fell into this field and realized, okay, this is where I need to be. Nurses do that, social workers do that, because we don't really hear about this field, which is one of the reasons we're talking today, to help people understand this field and see it as a viable career opportunity and a wonderfully rewarding career that you can have there. And is it a job? Is DSP a job or is it a career?
It's neither.
Yeah.
It's a sophisticated profession.
There we go.
It can become a career, most certainly, but we have to see it as a profession, Craig.
Yeah.
And our society is not quite there yet. I think we're getting there, making inroads. But until we do see direct support professionals as just that, professionals that need to have expectations and an elevated set of expectations, and
to be paid at that level.
Absolutely.
Do we even need to go there? Right?
Wages have always been abysmal. There's many reasons why the wages are so low. But that could be a whole other podcast episode.
Yeah. And we'll do that. I'll take you up.
We'll do it. But the reality is, we are not seen by the policymakers, by the funders. We're still not seen as a viable or legit profession to fund.
And the NADSP is kind of working towards getting that recognition, right? That's one of the many things that the organization does.
Indeed.
Yeah.
We are now able to do a lot more policy work, which we weren't able to do previously just because of our lack of personnel. But now we have more personnel, and we're devoting more time to policy work. In the last 2 years, we've had these things called advocacy symposiums, where we've had, in the last 2 years, probably well over, just close to about 1,000 direct support professionals in those 2 years, representing probably around 40 states. They have met with their legislators, their congressional representatives, albeit virtual, but that is powerful when the legislators who need to understand what direct support professionals do hear from direct support professionals what they do, things click. And our end game is this, Craig. We want to see the Department of Labor, the United States Department of Labor, and the United States Department of Labor's statistics grant us something called the Standardized Occupational Classification. We get lumped, direct support professionals in the IDDD world get lumped in with personal care aides and home health aides, who very important professions.
But this is different and requires a different skill set.
We need our own classification.
Yep.
And that's going to be the game changer. We'll be able to collect data and give proof to the funders that, you know what, this is a profession that deserves obviously more recognition, definitely more wages, but more expectations and required development, not required training.
Yeah,
and certification.
I like that. I'm gonna try to replace the word training with development.
You'll be my best friend
in my vocabulary.
Yeah, it's all good.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, "My ability is stronger than my disability." We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escude, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So John, one of the things that I like to do, and I didn't tell you about this, but it's 3 things in 3 minutes.
Go.
Do
it.
3. So what 3 tips, tricks, words of wisdom, pieces of advice can you give to listeners who maybe are contemplating a job in this field? What would you recommend, or what would you tell them?
Yep. Okay. I say first and foremost, learn about the history, particularly developmental and intellectual disabilities. Learn about our history. Our history is a very interesting one, a very tragic one, but also one of great hope. And if you don't understand what intellectual disability is or developmental disability is, and I hope most people do, but I don't think everybody does, learn about it. And if it's something that's intriguing, or that is I would like to work with people with intellectual developmental disabilities, there are plenty of places for you to either go volunteer, and meet people with intellectual developmental disabilities, talk to them, get a taste. But get ready if you want to be employed and have expectations and be a direct support professional. It's a lot more than just hanging out with people with disabilities. There's a lot involved. Yeah. But I think first and foremost, learn about the field and the history of the field. Okay.
All right. Learn.
Okay. Second, same question?
Yeah.
Okay. So I think the second thing to do is to be prepared that you're not going to be famous. If you're going into this work to be famous and rich, the wages have to go up. That's a given. But this is not work that we do for that purpose. This is not, and you have to be aware that at the end of any day, it will always be loose ends. The days for direct support professionals never end and get tied up with bows, and there's unicorns and chocolate every night that you're coming home to. It's messy work. Be prepared for that. But that messy work, the other side of it, that messy work is because of you, a person can have an incredible chance at a better life. And I think that's one of the biggest rewards of doing direct support work. The third, understand, and if you're going to get into this field, you must presume competence. Unfortunately, people with intellectual disabilities. Yep. Yes. Well, I think also sometimes in our peers, but I think certainly with people that don't use language to speak, because speech and language is not communication necessarily. Language comes in the form of many ways of communication, and some people we support don't speak.
Yep.
Learn.
They use other things.
Okay. Oh my goodness. I think we need to, and I don't care who you're working with, maybe somebody that does have lots of words, or somebody that might have lots of dynamic personality, behavioral issues. Everybody communicates, and you need to presume that what they're communicating is competent, and they are doing their best in situations where living with an intellectual developmental disability can be challenging, and primarily because of the barriers that society puts up for people. But I think presume that the people you're going to be working with, my goodness, they're going to teach you probably more than you'll ever learn in the classroom.
So great tips, great words of advice, and it certainly is a place you can have a rewarding career, no doubt. Now, you mentioned something about when you were 20, you wanted to be a rock star.
Yeah.
I would say you are a rock star. It's just maybe not in music, it's in this field. You do incredible work. Thank you for taking the time to talk with me today, and more importantly, for the incredible work that you do in this field.
And may I say thank you for what you do for the direct support professional community. There's not a lot of physicians that get us, and you get us. And not only do you get us, you are making clear how important it is to understand health and medical issues that come with people with disabilities. So I thank you. You're a rock star. Why don't we just do it? We could be a boy band.
Let's break out the boy bars. Let's go right.
Let's do it, Craig.
All right. Thanks so much, Don. You got it. See you next time.
Thank you, Craig.